Hello, it's Dr. Christine Arsenault, PharmD, Functional Medicine Certified Health Coach, and coming to you live today, wanted to talk about becoming a new version of yourself and your new identity, and how we are all either growing or we are dying. So if we're not becoming something new, we're basically dying. Those are our options, and so change is inevitable. And I know sometimes we get stuck in a spiral of negative symptoms. We feel like we're not making any progress. And I just wanted to remind you that change happens in small increments. And sometimes you're not aware of it as it's happening because it's such a small change. But then when you look back, you realize how far you've actually come. And so it's important to celebrate the little wins along the way. Because sometimes, you might have one symptom that feels a little bit better, but you still kind of feel like crap overall. And so you feel like you're not making progress. But if you keep track of your symptoms and you look back, sometimes you remember that you are in a better place. And it's easy to take for granted the changes that we've had and to just not notice them. We become accustomed to our new normal quickly. So even if we get to a place of better health, we become accustomed to it and it gets to be our new normal and we forget that we were even worse off before. So I'm really thinking about this lately because I'm back in Michigan right now. I moved to California 7 years ago from Michigan, and so I've been living in California the last 7 years. And now I'm back in the same city that I did some of my college in and that I worked in, and I lived here and I had friends here. And so I'm back to the place where I was an older version of myself 7 years ago, 9 years ago. I lived in Kalamazoo, Michigan for a while, and it's even more apparent how much I've changed now that I'm back into an environment that I used to be in as a different person. And so I just thought I would kind of share some things on how I feel different and how I was able to heal by making myself become this different person, and how now that I'm looking back, things feel so different inside, and I realize that I had to change the person that I was in order to reach that true level of healing. And if I had continued to be that same person and had those same thought patterns, I wouldn't have been able to progress. So one thing that I've noticed is that I don't have a consistent feeling of anxiety and dread. This like sense of impending doom or this anxiety. It was so much a part of me that I didn't even know that I had anxiety. I thought it was just my personality. In fact, I remember my functional medicine doctor like looking at my labs and how I wasn't methylating and like, are you sure you don't have any anxiety? And I was just like, yeah, no, I'm fine. But really, I was anxiety. Everything that I felt, it was just like always anxious on the inside. And like, now that's gone. And there's just this sense of peace and calmness. And I feel anxiety from time to time. It's not like it disappeared forever, but it comes up and I allow it to flow through me. And I'm like, oh yeah, I remember this feeling. This feeling used to run my life. And I just allow it to flow through me. And I just work on getting my mindset back to the focus of what I want, because you create your reality. So if I focus on what I want instead of feeling the anxiety, then I can quickly switch that. I can feel the anxiety, allow it to pass, and refocus on what I do want. And so it's different than how I used to feel inside before. And I also used to feel like I was a prisoner. I was a prisoner to a job that really wasn't fulfilling me, and I was a prisoner to my own body. So I worked as a clinical pharmacist in a hospital. It was a really good job for many reasons, but it wasn't my passion. And I've always really wanted to help people. And to me, helping somebody is getting them to a place of optimal health. And our healthcare system is designed, it's really sick care, not healthcare. We kind of band-aid you up, get you feeling a little better, and then send you on your way. A lot of people come back again. We don't address like the lifestyle factors, changing people's habits. And there's not really a place for that in the way the system is set up. It's not that healthcare practitioners aren't doing a good job, but their job is to, fix what's broken and send people on their way. And they don't have the time and energy to dedicate to the habits. So although I had a good job, it wasn't for me. I also have always been more passionate about natural medicine than pharmaceuticals. And while I think pharmaceuticals have their place, that just doesn't resonate with me. That's not how I live my life. So it just didn't feel like I was in full alignment with my job. And I felt like a prisoner. I had to be there certain hours and I wasn't in control of my time. And so now I work with clients who fulfill me. I'm able to help people. I'm able to see their results and work with them through that instead of just helping people that show up at the hospital and sending them away. And so now I feel like my work really fulfills me. I only work with clients I want to work with, and I'm able to craft my time in a way that makes sense for me so that I can continue to take care of myself first. So I have time for meditation and walking barefoot and doing all the things that I need to do, that I teach others to do in order to stay healthy. Because if I'm working like crazy and trying to help people and not taking care of myself first, then I won't have anything to give to others. So that is one thing that I've noticed since I've been back in Michigan on vacation here, is that I no longer feel like I'm a prisoner. Nobody else has control of my time, and I am free to live out my passions and do what I want to do. And then I'm also not a prisoner in my own body. I used to be so fatigued. I was a prisoner to my body. I couldn't do what I wanted to do. I was so fatigued. I remember I would work a shift at the hospital. I would come home and I would just lay on the floor and cry because I couldn't even muster up the energy to let my dog outside. Like, I couldn't take my dog for a nice walk. I would just like open the door and be like, okay, go pee and come back. Like, I couldn't even walk around the block. I was so exhausted. I could keep it together for work, get everything I needed to do done, but that was the end of my energy for the day. And I literally couldn't feed myself or bathe myself or anything after work. And it was really, really hard and really, really depressing. And nobody understood it because I looked okay on the outside and I was able to pull myself together to do what I had to do in my job to take care of other people. And I just sucked it up and did it. But I learned through healing that you have to give to yourself first. You have to take care of yourself first. You have to have that self-love. And now it just feels so different. And then the third, or I don't know how many things I've mentioned, but the last thing that I've really noticed being back in Michigan after being gone is that energy feels different. When I talk to my friends, I'm seeing old friends I haven't seen in years. It's been great reconnecting with people. But when people tell me about their problems, about their depression, their anxiety, I can listen with empathy without feeling the burden, like I have to fix them. Whereas before, I kind of felt like I wanted to help them so bad that it was like I was energetically trying to give to people when really you have to make the decision for yourself to change. And I was able to put energetic barriers up so that I feel like I can still be a support system for my friends. I can still listen with empathy, but I don't have a burden. It's not my place to try to fix them. And I don't feel drained when I hang out with people that maybe are going through a tough time and do need somebody to lean on. I was able, throughout my healing, to learn how to give my energy to myself and how to put up a protective layer as to not let others drain my energy, because I am an empath and I do feel a lot of things. And now it's like I can figure out what energy is mine and what is somebody else's. Whereas before, I think I was just so sucked in and I was just drained all the time, pretty much whoever I was with. It was hard for me to really be with anybody. And while I was healing, I had to kind of have my little healing cocoon where I just had time for myself and I just focused on self-care and self-love and everything that I had to do in order to heal. And yeah, so I'm able to get to this place where I am literally a different person. I had a ceremony where the old version of myself literally died. I had to grieve that person and become a new person. And that's how it felt to me. And so I don't use the word remission. When people ask me if I think it's possible to be cured, I absolutely do. And it's like a butterfly in their caterpillar in the cocoon turning into a butterfly. Once there's a butterfly, there's no more a caterpillar. The caterpillar doesn't exist anymore, and that's what it felt like to me. And just coming back to Michigan after being in California for 7 years, it's just like that reaffirmation of like, yes, I am not the person that I was when I was here, that person that was sick, that person that was drained and fatigued and in pain and always giving to others and always feeling drained energetically. But I have learned how to have barriers in place, boundaries, healthy boundaries, energetic boundaries, and I have learned how to express my emotions and allow emotions to go through me and to deal with anxiety in a healthy, productive way, to the point where it's something that shows up in my life from time to time, but it's not me anymore. It doesn't rule my life. So yeah, I'm curious, how are you changing? How have you changed since you got the diagnosis? I know so many people who are doing things in their life to help others after they have gone through something difficult because they had so many challenges with their own journey that they want to use what they've learned to help others. So I have people that tell me that they want to go back to that old version of themselves. But the secret is you can never go back. You can only go forward. But the person that you're going to be is going to be way better than the person that you were before. Way more advanced in certain areas. You're going to explore things that you never would have explored before if you hadn't gotten sick. So I know it's hard now, and I know you're yearning for that person that you used to be, that had the energy, that could play with your kids, that could go for a hike, that could go to your job and not be completely wiped out after. But the new person that you're becoming is going to be even stronger, and you're going to craft habits in place to take care of yourself and to put your health and your healing first. And that's going to serve you for the rest of your life. So even though this is something difficult now, what you're learning now is going to really just help propel you to a new version of yourself and going to give you lifelong skills so that you can always take care of yourself first. So go ahead and comment below. Let me know what habits that you are working on, what habits you want to leave behind because you know they're not serving your healing, and what habits you would like to add to your life to really serve your healing. And just anything that you can do to put your healing first, what that means to you. I would love to hear that in the comments below. And I hope you have a wonderful day.